PAD or peripheral arterial disease is essentially means, again, blockage of the arteries. Mainly we are talking about the arteries of the lower extremities, leg arteries. That is what we mean by peripheral arteries. So leg arteries, they get blocked again by the same process, hardening of the artery due to buildup of cholesterol, plaque and calcium and everything builds up in your artery. This is again either a process of aging, but certainly brought on by smoking. Diabetes is a risk factor, hypertension is a risk factor, and of course, I'm sure there are also genetic factors that we have not completely, we can explain completely, because we do have people who do not smoke, who do not have diabetes, who get blockage in their arteries. The problem is a lot of these patients with symptoms are mistaken for arthritis. Patients will say, oh, every time I try to walk, I have some pain in my legs. And so, but these are elderly people, and so people may mistake them for arthritis and just ask them to take aspirin or something like that. It's very important to ask the typical symptom of the patient. The typical symptom of blockage in the arteries of the leg is that every time the patient walks, he has to stop after a certain distance. Let's say he can walk 1 block. He would say, a year ago I used to walk 2 blocks and no problem, 3 blocks. Now in the last 6 months I can only walk 1 block and I have to stop because my calves cramp up, my legs cramp up and I have to stop. That's very classic for arteriosclerosis or peripheral artery disease. And it's always constant because the block doesn't come one day and go away the next day. So the patient says it's very constant, it's very consistent. So he says, every time I do that, I have to stop. When I stop, I feel better, I go. So this is called claudication, which essentially means, in Latin, it means limp. So in other words, the patient has to limp to start walking. So once anyone who has this symptom, it shouldn't be just brushed off as arthritis, that he's old and other things. One should look for pulses and examine if he has arterial disease, because if he does have arterial disease, then we can follow him. As I said again, risk factor modification is very important. A lot of these patients actually, they think that every time they walk they get the pain, so they become couch potatoes. They don't exercise anymore, they don't walk anymore. They just sit thinking that they're going to harm their legs, or it is the other way. We actually would like them to exercise as much as possible. Just by walking, a lot of these patients, about 20 to 30% of these patients can improve their symptoms. And of course, if it starts getting worse, then we have methods to treat this. We can do either bypass. Nowadays we can do balloon angioplasty. If the artery is narrowed, we can pass a wire over which we can pass a balloon and open it up and then put a stent, just like we can put a stent in the heart arteries. It's called stenting and angioplasty and stenting. If it is extremely severely blocked and it can be done, we have methods to do bypass. We can do a bypass from the healthy area above the block to healthy area beyond the block. And this is how we can save the limbs, because if there is no adequate circulation, what happens, even a small trivial trauma like even cutting a nail sometimes, and if you injure it, it may not heal. And particularly if one is a diabetic patient, clearly it's a bad. Diabetes and peripheral artery disease are 2 bad combinations, and what happens, the patients can progress on to develop gangrene, which means death of the tissue, and can lose the limb, they end up with amputation. So this is another area where it is very important to pick the presence of arterial disease before the catastrophe happens.